I know everyone is probably irritated, tired, and upset by this pandemic already. You probably have mask fatigue. Now imagine how tired the homeless must be. They don't have a home, they don't have things we normally take for granted. Like we probably wouldn't think about where and how we're going to take a shower. We just already have one in our own homes. On top of that, we've been dealing with this deadly pandemic for a year now, which is why we should shift our focuses onto the homeless population. The homeless needs more resources and help, especially during COVID-19. As y'all know, COVID-19 pandemic is still ongoing and there's been new rises in cases all over the country. We can use this time to reflect on the problems in our communities, we can reflect on the privilege, and think about how we can help others. We can make a change. Now, I have personally volunteered to help feed the homeless on multiple occasions, so I do somewhat understand and I do sympathize with them as I was able to talk and connect with them. So today I'll be talking about the homelessness issue in America, how they're affected by COVID-19, and what we can do to help. First, let's talk about the growing issue called homelessness and how big it has become in the United States. We need to acknowledge the ever-growing population and how homelessness is a problem. Barker, a writer for New York Amsterdam News, has shown that reports indicates that calls to 311 about homelessness were up 72% compared to last year. The Mayor's Management Report released last month reveals homelessness this year is at a 5-year high. Before COVID-19 hit New York, they had a record number of homeless people. While the number of homeless families has decreased, the number of homeless single adults has continued to grow. Many single adults have been displaced from already unstable living conditions, such as room rentals. As a result, homeless encampments are becoming more visible on city streets. Over the years, the homeless population has continued to grow, especially in heavily populated cities such as New York. Now, it doesn't help how society views the homeless. This creates a bigger issue. As ENP Newswire from Washington State University has said, it's a stigma. These individuals are seen as lesser humans. People avoid them. They have increased risk for disease, malnourishment, violence, and always have their stuff stolen. It directly affects their health. When you don't treat these individuals like they're human beings, it discourages them from seeking care and worsens the condition they're already in. So normally when we think of the homeless, we often look down on them. However, they're still humans. They're just going through a tough time. The connotation around them is just bad because it causes a disadvantage when they're already struggling to keep themselves safe and healthy. So now that we've learned a bit about homelessness, let's talk about how the ongoing pandemic is impacting them. The homeless people are negatively impacted by this pandemic, but they already have a huge disadvantage. Canadian Medical Association Journal has shown that individuals experiencing homelessness are at increased risk of infection with severe acute respiratory syndrome, coronavirus 2, owing to their lack of safe housing, and also at higher risk of having a severe case of COVID-19. Given the high prevalence of risk factors in homeless populations, people experiencing homelessness often find it difficult to adjust to public health directives such as physical distancing, isolation, quarantine, because of shelter conditions and other challenges. People who are homeless often have higher risk to multiple diseases as well as COVID-19 as they lack the resources and qualifications to keep themselves safe and healthy. CHEST, an academic journal and organization that's based in medicine and health, has shown that homeless populations have always been a part of urban city life. The COVID-19 pandemic has exposed societal fault lines and raised greater awareness about the vulnerabilities and issues faced by this population. Societies, along with their governments, have to rally more resources to support the homeless. Failure to adequately shelter and accommodate homeless people could lead to more COVID-19 outbreaks that's difficult to contain and track because of the nomadic nature of these people. COVID-19 has shown the problems that our government has failed to notice, and it's a dire situation that needs to be fixed as the homeless population is negatively impacted by it. We have learned how COVID-19 has impacted the homeless population in numerous ways negatively. Let's focus on how we can help improve the situation and help them through different resources. We can make a difference by helping the homeless community in our community, and here's how. Modern Healthcare, a website that's highly well known among healthcare executives and have a high quality editorial team, stated Congress allocated more than $4 billion for homeless specific programs as part of the Coronavirus Aid, Relief, Economic, and Security Act, also known as the CARES Act. and they have made billions more available at the discretion of federal and state officials. But more than 4 months after the passage of CARES Act, the Howard Center found HUD had given communities access to less than a third of the money, and those with access are still waiting on federal guidelines on how to use it. When the money does arrive, not all of it may be used to help the homeless people. With that said, we should donate more money to directly support these bills and acts to improve. So as little as $1 from everyone can build up and make such a big and positive impact on those in need. The Lancet, a medical academic journal that has been around for 200 years, has found as other cities follow suit, these actions might further displace people experiencing homelessness and put them at greater risk of COVID-19. Another complicating matter is that in December 2019, the U.S. Supreme Court declined to review the case of Martin versus City of Boise, upholding a ruling that cities cannot arrest or punish people for sleeping on public property unless cities have provided adequate and accessible indoor accommodations. This legal precedent prevents the criminalization of the homeless. Homeless people are more likely to get arrested quite often due to the fact that they're homeless, but they haven't done anything except they're trying to get through the day as they're already going through a tough time on top of an ongoing deadly pandemic. We should support this case and petition that the U.S. Supreme Court should look at it again. Finally, we have finished up the last main point. We have learned how we can help and give more resources to help improve their situation. Let's move on to reviewing the main points today, shall we? Now, we can help the homeless during the COVID-19 pandemic. Homelessness is an issue in America, and we could take this matter into our own hands and take action. The ongoing pandemic has created such a huge negative impact on the homeless population. We can help them through this tough time and make such a huge difference. Even though COVID-19 has caused such a negative impact on those in terms of social and psychological health, physical and financially to either yourself, your family, or your friend, etc., we are still in a very privileged position as we can still be healthy and supported. We can use our privilege to help others in need, so no matter how small it is, it goes a long way. From raising awareness to donating some food and toiletries to starting fundraisers and getting help from government officials, you can help. Help out your community, just help.